Heart failure is a disease process of the heart muscle that has been damaged or is compromised by things like arrhythmia, blockage in the arteries, viruses, high blood pressure. Any number of things can insult the heart muscle, some of which can be reversible and some of which cannot. We want to use medications that are tailored to actually reverse some of that process or stop it from progressing. That's very important in terms of getting you to the right person with the right expertise. And so focusing on when you develop these symptoms of things like shortness of breath, you develop problems waking up, gasping for air, swelling in your legs. Those are classic signs of heart failure and can be signs of other things as well. They're definitely a reason to reach out to your doctor, and you may need to consider something like an echocardiogram. That echocardiogram is an ultrasound of your heart, and it gives us an idea of how the blood is flowing and how well the heart is pumping. Heart failure does have stages associated with it. Stage A heart failure is there patients who have risk factors only. There's someone who's had chemotherapy or has had blockages in the arteries, high blood pressure, any number of things that can contribute, but they do not have symptoms of heart failure and they do not have blood work or picture evidence. Stage B heart failure is when we would actually see that the patient has no symptoms, but we'll start to see diagnostic imaging and blood work evidence of heart failure. Stage C heart failure means that you have that diagnostic imaging as well as the laboratory evidence of heart failure as well as symptoms. Stage D is when we really have to think about traditional treatments for your heart failure are no longer working and what is our next step. Some patients will be able to undergo a left ventricular assist device implantation. Another option would be transplant. Some patients opt for symptom-focused care. One part of my job I really love is that I get to take care of women with heart problems in pregnancy. We call that cardio-obstetrics. We meet monthly and review patients that are pregnant and actively have a heart condition that we are concerned about or they've had one in the past. We make sure their delivery planning is appropriate for them and also get them the resources they need to navigate their pregnancy as safely as possible. We support them both before pregnancy and after pregnancy, and make sure that they are getting the best care they can here in the area. We have seen a significant benefit to our patients from this planning, and patients also have noticed that they are receiving well-coordinated care. That gives us great joy when we have a healthy baby born, and even more so a healthy mama afterwards.